Hello everyone, welcome to my channel. Today I'm going to talk about periods and PCOD. All right, so before I talk about polycystic ovarian disease, let me tell something about periods. Periods, it's completely a natural process that occurs in a female body around 14-15 years when she attains 14-15 years old, when she's around 14-15 years old, or it can be like 12-13, depends on um, lifestyle and different factors contribute to when you'll be getting your first period. All right, and what causes periods? So periods happen because of different hormonal changes that happen inside a female's body. So female hormones are estrogen and progesterone, they keep building up. So what exactly happens when you get your first period is these hormones build up, okay? And they cause the thickening of the lining of the uterus. When there is no fertilization, when there is no um, when there is no fusion of sperm and an egg, and when there's no fertilization happening, what happens is that lining breaks off and it leads to discharge. All right, first you'll be seeing a white discharge followed by your first period. That is nothing but the uterus lining that is completely broken down. Okay, so that's basically like first the uterus was preparing itself to hold the baby, but because there is no fertilization happening, the lining just breaks out. Okay, and many children might be watching this video around like 14-15 years old, or mothers of teenagers who might be watching this video, or like different age group. So I would like to mention that it's better that if you're even 12, 13, 14-year old watching this video, it's better you do your own research about period before experiencing itself first time, because you would not be freaked out when you get your first period, right? It's completely natural and it's actually like a little girl becoming a little princess kind of a thing. Okay, so things to expect is you would be seeing blood clots, you would be seeing cramps, you would be developing mood swings. There are different kinds. You might have anxiety, and first time when you get a period, there's nothing wrong. Like you can just openly talk to your parents or your doctor, and there are different ways on like how which kind of pads you would like to use, but preferably cotton is better because it will not lead to much infections. And um, and if you are a swimmer or a sports player, and you might be thinking, would this periods affect your career? No, you can dance, you can do whatever you want with your periods around the time. What do I mean is, even when you have periods, you can do a lot of jumping also. Like there are different ways how you can play your game while on periods. Like you can use tampons also, but then remember, um, tampons are less safe than sanitary pads, because tampons can lead to toxic shock syndrome if you just leave it over like for 8 hours and you forget about it, and that's like a deadly disease. So I'll be talking about toxic shock syndrome in my next class. But just remember that there are different ways. There are menstrual cups, there are different kinds of option around you, but look for something more natural, not for something that just promises saying that it will stay for a long time. Anyways, you should just be changing every 8 hours. All right. So that's about period. So it's a completely natural process, and it's nothing but the lining of the uterus which will just break down, and that's what you see. All right, so do not get scared when you experience your first period. Okay, now, and don't let it affect your career or your studies, or you can't just skip your school saying that, oh, it's my period day. All right, it's completely normal, and it's just a natural process which keeps occurring every month, every 28 to 30 days. Now, what happens if you do not get your periods regularly? Like, what would really happen if you do not get your periods like for 45 days, 60 days, 90 days, or like maybe in a yearly you just get 2 to 3 times? So, first, when you experience your period, just make sure that you observe your body. More than anyone, you will be knowing your body really well. So when you experience your period around 14, 15, 16 years, whenever you get it, notice what are the changes. Like maybe there might be a slight weight gain. There might be changes in your upper body, lower body, and different things. But if you're experiencing hair growth in a very abnormal way, like, if it's growing way too fast and you're not getting your periods around more than like 45 days every month, you're following, like you can see the same pattern repeating, then it might be um, a thing to worry about. So it can be that it is PCOD. Now, what is PCOD? Polycystic ovarian disease. So we have a pair of ovaries, right? I've explained about PCOD in one of my previous videos. In case you did not check it out, I will leave the video link in the description below. Please check it out, where I have shown like what happens exactly. So usually when you see ovaries, they're plain, all right, and we have a pair of ovaries. But if there are many follicular fluid filled cavities, like if you see poly means many, and if there are cysts, tiny cysts, then that is called PCOD. Okay. Now, how do you think like you would know if you have PCOD? First thing is, when you notice these symptoms of hair growth and irregular periods, please talk to your doctor, your primary care, and then you can go to gynecologist. So please tell whatever you feel, because only then the doctor will be able to diagnose your problem. All right. And every PCOD patient does not have the same mode of treatment. And nowadays, out of 10 women, 8 women have PCOD or PCOS, and it can be reduced and it can be completely be eliminated by just changing your lifestyle. Every day, by incorporating a half an hour of exercise and by losing weight, the cyst might just disappear also. But let me tell you something. Please make a note of this. Like, from the time you get your first period, notice changes. Make sure you are checking yourself every month. How is your body doing? Okay. Because even at 15, you can get PCOD. Even at 16, 17, you can see polycysts. Now, when you have a doubt, you go to a doctor, and then the doctor might ask you to go to a gynecologist. Now, gynecologist will ask you a bunch of questions. Please feel free to tell her, where do you see the hair? What is the kind of, like, if you have any hair loss, if you have any problem, talk to the doctor openly. Then doctor might say that, okay, I might suspect PCOD, so I would suggest you to go for a test. And then they might prescribe you now transpelvic test. So when they prescribe you this test, you might be thinking, oh my God, so they're going to examine the ovaries. I'm scared. I wouldn't just go for this test. No way, no. Don't freak out or something. It's going to be a very normal test. And when you go for the test, actually, what are the doctors really looking in the test is, they are actually looking for the size of the ovaries. They'll be looking for the thickness of the endometrium. Remember, I told you something about how would you get a period? So for the uterus lining, which is there, which will be actually getting thickened over time, and it will be ready so that, when it receives the sperm, there will be fertilization. But when that doesn't happen, that endometrial lining will break off. All right. And that is what you see as the period. Okay. And that's normal. But if you're not planning for pregnancy and still, like, you cannot see your periods normal, what might happen is your endometrium might have been thickened over time. All right. And that's really not good, because undiagnosed PCOD, PCOS can lead to endometrial cancer in future. So that's what doctors are looking for. So in this test, a radiologist will actually look at, the size of the ovaries. How are they? Are they bulky or are they normal? And if they are normal, how do they look in deep? Like, morphologically, like the shape of the ovaries, it might be looking normal, or there might be like some cysts around your periphery. So what happens is, when they will see, like, they might be of two types. They might be like small cysts, and they might be big cysts. So if they're big cysts, then, the gynecologist will do some procedure and make sure that they are done surgically or non-surgically, depending upon. But if there are small cysts, you know what? It's easy to control. It's easy to control at that level, rather than just ignoring the fact that it's fine. All right. So one of the main thing is first try to eat normal food. Now what do I mean by normal food is eat the food in its natural form, like if you get strawberries, eat strawberries as strawberry rather than having it in a jam or a packed salad, or a, strawberries in cereals with a glass of milk. All this is really not good. Having something really hot from tawa is better, like let it be steamed idlis, dosa, paratha, pancake, just scrambled eggs, anything. And then eating a lot of good food, not just giving importance to protein and not giving importance to the whole food, and having a regular exercise every day of 30 to 45 minutes, and making sure that your stress is in control makes a lot of difference. All right, so this is a lifestyle modification that you will be doing. Now, after seeing that, like maybe doctor might say like, okay, let's see, most of the common symptom is this weight gain in PCOD patients. But let me tell you something. There might be weight loss also. So this disease is different in every female. So just the common symptom is irregular periods or hair growth. So, and why does hair growth happen is there are more male hormones than female hormones acting in your body. So that's the reason that you're seeing more hair growth than normal. Okay, so doctor might prescribe you medication, and then don't worry that okay, why is doctor prescribing these kind of medications? Doctors might prescribe you something like um, medications which are given for diabetes. That's because in PCOD patients, the cells become insulin resistant. And so that the cells revert back to the normal, doctors might prescribe medication. And don't worry, this is not like a lifetime medication thing. Once you again go for regular tests. So that's the reason why from the age of 16 it's advisable that get yourself tested regularly, not just wait for like 30 years old or 40, 50, and then you never get tested. That's not how it works. You need to see how your body is responding to medication. You need to see how your body is responding to exercise. Maybe over a time, the disease might get minimized. So another common thing is how are we really cooking the food and how are we storing the food. And if you're in India watching this video, it's better that you cook food in matkas. I hope you know, like the clay pots, because that's when you're doing minimum damage to the food. Overcooking of food is not advisable. Eating the food in its natural form, like just a very minimal stir fry or boiled food is good. And then how do you store it? So using microwave, using refrigerator is not a good option. It's better that you cook little and then consume it that day. And if it's not working out, at least make sure you're not storing the food in those plastic containers and heating them again in plastic containers, because you know what? Plastic containers have xenoestrogens and they play with your female hormones. So avoid plastic in case you want to, minimize your PCOD, and make sure that you're storing food in stainless steel or glass. All right, and the way how you're storing oil, food, everything matters. So minimize plastic and make sure you use stainless steel or glass containers more often. So this is how we can control PCOD. The main points that I have told is like by doing exercise and by making sure you're stress free, and by making sure that you have a note on how your periods are, and making sure that you do visit a gynecologist. All right. So in case if you're a 15-year-old or like a young adult watching this video and you have any of such symptoms, feel free to talk to your mother or your father, or like if you're in touch with your PCP, primary care physician, or your doctor, please tell them what you feel. There's nothing wrong in experiencing changes in the body, and there are a lot of options on how you can make sure that all those symptoms are under control. So thanks for watching my channel, and stay tuned to my channel for more videos. And in case you like this video, please click on the like button and make sure that you subscribe to my channel. And if you want me to make such similar videos, and if you have any topic of your interest, please leave your topic of interest in the comments below, and I would love to make videos for you. And I hope you have enjoyed this video, and you find something interesting and something you have learned a little bit about what I'm trying to tell you. So thanks for watching again and stay tuned to my channel for more videos. Thank you.